I'm Andrin Jones. I am 62 years old, 42 years married to my life partner. We're both retired Air Force, 4 adult children, wonderful children, 9 grandchildren. 3 years ago, I was looking for a new primary physician. My wife found a list for me and I chose Dr. Lance Wallace. I was kind of afraid of what the journey might entail, which resulted in a diagnosis of stage 2 prostate cancer. It was the reality of what I suspected, that something was going on with my prostate. And I think that it was the way that it was conveyed to me by Dr. Wallace.
When a patient comes to me, the most important thing to me is to answer their question. What is it that they're concerned about? You know, I may have 5 other things in my mind that I think need to be done during that visit, but the most important thing is what is bringing them in. They're coming to me for a reason, and I need to address that.
When he got the test results back, he said, "Mr. Jones, I see that your PSA level was elevated in 2019. Was it addressed?" I said, "No, this is my first time hearing about my PSA level." And I think that began my confidence in the primary doctor that I had at that time, being a new patient.
So with Mr. Jones, you know, I looked at the whole history, but we did a battery of tests. The PSA came back suspicious because it was elevated. So that was something that we needed to address right then and there.
In my morning walks at the Forest Preserve here, it's an environment of people who are health conscious, different ages, genders, and that. In my walks, I was really putting it in God's hand, if you will, praying about it, and just waiting for the next lab work to be done. And even after those results came back, my PSA level was still elevated. Dr. Wallace took the next step and referred me to Dr. Siegert. When I saw that partnership, he said, everything that goes on there, my eyes are going to be on it as well.
So when I met Mr. Jones, we had taken a history, looked at his PSA trend, which had been increasing, which it should increase. In his case, it was going up a little faster and a little higher than what we would expect. Within the context of Mr. Jones' otherwise great age and long life expectancy and great health, we decided and discussed basically the role of doing a biopsy, which is further testing to determine the cause of the PSA number going up.
I met with Dr. Siegert, and I really appreciate how thorough they were. And the next step was to do an MRI. That came back inconclusive. And he prepared me for every step that he was going to take.
So with the type of prostate cancer that we diagnosed Mr. Jones with, which is what's called localized cancer, meaning confined to the prostate, you really have 3 main options: surgery, watching it, or what's called surveillance, and then also radiation as an option. So we discussed all 3 of those options, the risks, the benefits. Ultimately, the outcomes of all 3 for his particular type of cancer are equivalent. And so it really is a personal decision. He met with the radiation oncologist, he met with me, the surgeon, and after further discussion opted to move forward with surgery as his definitive means of treatment.
It was on a walk that I made the decision to have the procedure. And I had all the necessary information that I needed from Dr. Siegert to decide on the treatment option.
We use what's called multidisciplinary care, where we involve multiple different team members within his care team to opine and offer their recommendations. But ultimately, because it was caught early enough, he had the luxury of time, he had the luxury of making whichever decision was best for him. And that decision for him was surgery.
After the procedure, just the relief of having done what was necessary and just being so thankful that it wasn't done too late, I began to list them in my phone as my healthcare team.
Mr. Jones is doing very well. You know, he's doing very well, and he should continue to do well. He came to see me, and we did the screening test. That's how we detected his PSA to be elevated, and we were able to determined that he had prostate cancer, and we detected the prostate cancer in an early stage, which has resulted in him having a great outcome.
Out on the walk trail, I began to develop this perspective on life after the procedure. This time last year, I had cancer. Today, I don't. I'm so thankful for the specialty physicians of Franciscan. They allowed me to trust them. I feel that the rest of my life is going to be better, much better, because of what I know. And again, I was reminded of what Dr. Wallace said. I wish that I could catch my male patients at this stage.